Hi everyone and welcome to Mind Aids. In last week's video, we talked about health anxiety and its impact. Let us now discuss 6 ways to deal with health anxiety. The 2 broad facets of health anxiety you need to work on would be challenging your unhelpful health-related thoughts and reducing unhelpful health-related behaviors like excessive checking, reassurance seeking, and avoidance behaviors. If you find yourself having excessive health worries, you may have noticed that your concentration is not so good and your attention keeps shifting to your health-related thoughts. At this time, bring your attention back to whatever you were doing. This is called task focusing. For example, if you were cooking and you notice that your attention is wandering to not so urgent health worries, bring your focus back to cooking and the details related to it. You don't have to be judgmental about your wandering thoughts. Just try to gently shift your focus to the present task. If you feel that your health concern or worries are extremely important, you could use a thought diary. You could write down your thoughts as and when they occur, but leave its dissection for a later period. Rest assured that your health worries are not being ignored. Remember the thought diary you used to write down your health-related thoughts? Schedule a 30-minute worry period so that you can spend time with your diary and yourself. During this time, you are allowed to focus and worry as much as you want on all your health concerns. But once this time has passed, postpone your health-related worry for the worry period that will be next day. During the worry period, instead of being bored with just focusing on your worries and spiraling down into much severe anxiety, it would be helpful if you engaged in some self-questioning. For each unhelpful thought you have written down, write down your level of conviction with it, like 50% or 80% or 10%. Then ask yourself and answer these questions in as much detail as possible. Is there any evidence that this health worry is true? If it is true, what are the worst possible consequences of it? Is there any proof that you will not be able to deal with the worst consequence? Now grill yourself for strong evidence either defending your health worries or rejecting your health worries. Based on the evidentiary support, now note down a new level of conviction for the unhelpful health thought you have been examining. Continue this questioning till you reach a level of conviction enough to either reject the worry or continue the worry. You may develop obsessive levels of checking and reassurance seeking as ways to cope up with your health anxiety. This may give you some relief in the short run, but over time you may have to do more and more of it and still be unable to obtain any relief. Use a diary to note down each time you perform a checking behavior or when you seek reassurance from a health professional, family member, or the internet. At the end of the day, review the number of times you have done each of this. Now set an easy target to reduce these behaviors for the next day. For example, if you researched dry cough related to COVID 7 different times, make a target to do this only 5 times the next day. If you have consulted a health professional when you have only one symptom, try to make a target where you consult the professional only when you have more than 3 or 4 symptoms. This is usually effective when you combine it with exposure to your feared thoughts as well. You may have been avoiding certain places or people to reduce your health anxiety. You may also have certain thoughts that are fearful to you that you're intercepting with checking and reassurance seeking. Use a diary to become more aware of these and note down the times that you tried to avoid or distract yourself from a fearful health-related thought, place, or situation. Set easy targets to reduce this avoidance by finding a way to begin exposing yourself to this fear. Do not dive into the exposure head first. Try dipping your toe in the water and slowly wade into exposing yourself to these fears. Remember, the more you're exposed to such fears, the more you're sensitized to it and the lesser its capacity to evoke any anxiety in you. Also remember that this is for irrational, unrealistic fears and not for fears that are realistic. The anxiety of contracting coronavirus is a legitimate one, but if you're following all the health guidelines as instructed by the authorities and you still feel overly anxious about your health, the strategies explained in this video would be helpful for you. Many of you may find it easier to perform these activities on your own, and some of you may find it difficult. In case of being unable to use these strategies on your own, or if they are not working for you and you still have excessive health anxiety that is interfering with your daily life, please feel free to contact your mental health professional. A psychiatrist or a clinical psychologist would be able to help you with maximizing your mental well-being. Do let us know if you found any of these strategies helpful. If you have any queries, you could comment in the box below or you could email us. For more videos like this, like, share and subscribe to our channel, Mind Aids. Thank you and have a blessed day.